Okay. Welcome everyone as you're continuing to join in and grab your lunch or wherever you are with snack with eating. I'm Sandy Chifulius. I'm one of the co-directors of the Collaboratory on School and Child Health. I'm here with, of course, our esteemed speaker as well as our co-director Jessica Kozlowski to welcome you. Um, we're so excited to have Dr. Reaves with us here today. The work that she's doing aligns so well with the Yukon mission and the Collaboratory on School and Child Health mission, and it's perfect timing just coming off of celebrating World Mental Health Day. So without further ado, I just want to quickly introduce Dr. Reaves as an assistant professor at the National Center for School Mental Health. She's an experienced mental health clinician and researcher who provides technical assistance to schools, districts, and state leaders around everywhere around school mental health quality improvement efforts. She's trained as a clinical community psychologist. She believes that great prevention work can be done and realizes the importance of strengthening the systems that children are nested in promoting well-being. And she's committed to supporting schools at multiple levels to improve policies and procedures around student social emotional functioning. And I think she's going to tell us a little bit more about that as she gets started.
Thank you so much for that lovely introduction. I appreciate it. I am just going to share my screen so that everyone can see my slides. And does it look good? Awesome. It's great to be here today. Thank you so much for having me. I am looking forward to continuing this conversation a bit with some of you after as well. I love talking about school mental health systems and SHAPE, and so I'm happy to have those conversations and see where we can go in terms of being able to promote our practices and improve outcomes for our youth and schools more generally. So today we're just going to chat about comprehensive school mental health systems and think about how we apply this work, what it kind of looks like as we're approaching it, and where we're at now. So I have some data that we pulled from our SHAPE system that just shares some descriptives that I think could be a nice launching point for questions or to think about your schools more generally in Connecticut and what this might look like and how this work might apply there as well. Okay, so we'll start by just reviewing what is comprehensive school mental health. In this one, I'm gonna throw back to you all. So I think your chat boxes are open. I want you to think about what are your key ingredients for a great school mental health system. If you were building one for students that you interact with or that you've seen come through your work or are hoping to work with, what are some of those key ingredients that you think are really important to having a foundation when we're thinking about the offerings that we're bringing to school settings? So if you want to pop those in the chat, I will read some of them through. Oh, also, I have slides in here that say some people might say, and this is my way of giving you a chance to type your answers in the chat. And also, I know that there are some folks that are watching on live. So just so that I have some time to fill the time while you're thinking. So some people might say that it's really important to have a variety of services, that caring relationships are most important, or that they're based in student voice, that we have good available services, partnerships, flexibility. Some folks may be really concerned about whether or not their solutions are evidence-based or that leaders are involved and that we have helpful policies there. Or that that they're just available and they understand who I am and they're giving results and helping me feel better. And then we've got, oh, our chat is going. Thank you all for putting it in there. Positive relationships, absolutely. Communication and connection between a variety of departments for effective collaborations. Lessening an emphasis on grades, having a positive school climate, widespread awareness of services, tiered supports across the continuum, policies and protocols, gatekeeper training, implementation school wide, teacher support. Thank you. Keep them coming. Stigma and addressing stigma. So yeah, there are a variety of ways in which we think of strong school mental health systems, and the reason that it can be important to think about what it is that you're hoping these systems become is that oftentimes this work requires a lot of collaboration, a lot of partnership, developing a lot of buy-in. So reconnecting to what's important and ensuring that those stakeholders are on the same page is really important to moving the work forward, to having the quick synopsis of what are we shooting for, what are we hoping for when we're investing in these interventions or investing in these trainings. So being able to come back to your why or your what are we trying to do, can be really helpful. And also, like a good recipe, it can evolve, unless it's grandma's. Unless they're grandma's yams, you just gotta leave them the way they are. But other than that, there's always room in a recipe to adapt to your own taste, your own new knowledge, new recipes. Now you can put everything in an Instapot, right? So we can connect and remind ourselves of what is important, but also leave a little flexibility for new voices, new needs, new knowledge. We've heard a lot that schools have changed a lot since the pandemic, right? And needing additional supports around social skills and being able to bolster those. So that's just an evolution of a need in terms of what has gone on. And it can help us create a shared vision. So just come back to the things that are important when we're feeling overwhelmed or like things are not going our way or there's a stressful road ahead. It can be helpful to reconnect to what it is that we're hoping for, that we're identifying, and to create that vision with your partners. Because it might be a little different for everyone, as we can see just from the chat box, right? That there are different things and priorities for different folks. And coming together and having a shared vision can be really, really helpful as a foundation for building upon that work. So here's our long definition that we use at the National Center for School Mental Health, and it encompasses a lot of the things that you all have already discussed in the chat as well. So it does suggest that you have a full array of supports and services that span that continuum from promotion to treatment. And the reason is that this allows a lot of different entry points and opportunities for children and families to interact with the mental health system. We know that most kids who need services do not receive them at our tier 3 level. So school mental health opens up this opportunity to catch those kids in other places and spaces and interact with them in a different way that might still promote positive skills, still might reduce symptoms, but not necessarily be in an outpatient setting. So comprehensive school mental health is really designed to provide that variability and that flexibility in those different ways of interacting with the mental health system so that students and family have choice and options for how they want to do that. It also is built on a strong foundation of just school and district professionals in partnership with our students, our families, and our community providers. And I seen that in the chat as well. Positive relationships, good partnerships, having leadership involved. Teacher support is always instrumental into implementing new interventions. And this just really makes sure that the system that we're creating stays locally grounded and is informed and stamped by the people that are most important to it. We know that there are tons of evidence-based interventions, and you can have the best one in the world, but if nobody wants to use it or finds that manual too complicated to pull out, they will not do it, no matter how great it is. So really focusing on those relationships, coming to an agreement on what we're doing as we're moving forward and prioritizing the voices that matter most can be really helpful in creating a system that is not only high quality but sustainable because it's within the interests of the local context and the local stakeholders. It is also important to think about our social and environmental factors that impact mental health. So this means taking not only thinking about how can we reduce symptomology, but how can we improve our environments to promote positive behavior and positive mental health outcomes. So not only focusing on the individuals that need support, but thinking about how we as a community are supporting this work and what social factors might be barriers to folks participating. So those are important as well. And when we're thinking about comprehensive school mental health, and we'll go through these in a bit more detail in a bit, is we're thinking about this across seven key large domains. And this is a little different from a traditional outpatient setting, which mostly is often focused on our tier three for our students who need individualized long-term usually support services, whereas comprehensive school mental health allows for earlier intervention and promotion and is built on this kind of community of stakeholders who are engaging in this work to improve the system for kiddos. And it's also important on our little angle there that we're using progress monitoring tools and evaluating our impact so that we can always work to improve what we're doing. So why do we think it is important to have those positive relationships, to give those tiered supports, to and use mental health literacy in our school systems? What do you think are some of the benefits to including mental health supports in schools? So I'll give you all a minute there too to uh, type your responses into the chat box there. And I'll go to my some people say slide so that folks who are joining us online have something to listen to while you all are typing. Oh, great. Yes, early access. That's a great one. Oh, we're on the same wavelength, Jocelyn. Access, right? Some people might say schools offer really good access to students who might be in need. Every most people are required to go to school. It's a good place to meet kids where they're at. There, it removes some of those transportation barriers and things around time to be able to offer them in a place where students are already at. It's a way to help students who may be in need. It's a good way to support staff. We know that some addressing mental health challenges and behavior in the classroom can be a real stressor for staff. When I was in grad school, we had a qualitative study on teachers who were reporting incidences of violence and aggression in schools. And one of the things that came up in the qualitative data was feeling like unsupported by their administration around those problems was really seen as a really difficult feeling in addition to what was maybe happening to students. So that kind of lack of support can be really can be really important to staff. And school mental health often offers an opportunity to support staff as they're supporting students in the places that they're at, and can help address some of those concerns as well. And in the chat, we've got ones around decreasing stigma and providing mental health education, right? You have an opportunity to reach every classroom in your school and to be able to make sure all students have a baseline understanding of what coping skills might be helpful or what are the signs and symptoms of mental health. It can improve academic and social emotional outcomes for all students, address social relationships, reduce stigma, and increase understanding. There's also flexible. They can things can be flexibly adapted and set to and match the setting in need. Yeah, and then really normalize talking about mental health, right? The more that we have these conversations can be really helpful in reducing some of that stigma and the feelings that, that this is just happening to me and there aren't any resources. Thank you all for dropping things in the chat. And the research agrees with you, right? There is some evidence that having access to services in schools is really great for improving those social emotional skills and impacting outcomes and reducing referrals and reducing disciplinary action and increasing engagement. And these are all obviously very student focused outcomes. But again, I think it's important to think about the larger community as well, right? Having access to services and supports also supports staff. Having access to early intervention can also have great economic outcomes for our communities if we're able to address mental health difficulties earlier and set folks up for success earlier. That has great implications for not only individuals and families in schools, but also our larger community, right? Because we're being our folks are being taken care of in a way that can help promote positive outcomes and reduce some of those economic challenges on communities from, needing to be in long-term inpatient care, for example. So, So that's a little bit about what we're talking about in terms of the domains, thinking about it as more than just individualized supports in our larger tiered system, and why we're doing it or why we think it's important is that for all these great reasons that you all dropped in the chat is that it can have really positive impacts on our community, and those are some of the reasons why there's a strong push for including it in our work and education environments. And there's not one answer, as we could see from the variety of things that happen that were put in the chat, right? But there are some foundational things that can be really helpful to putting this work into place, and one of those is to work together. It is really hard to bear the brunt of trying to change the system alone. I know there are people trying. I've met with those folks, and I know that sometimes we've all had to work in our silos, but the work is definitely easier if we can work together. And that helps with not only sharing the load, but again, making sure you're building something that folks will use. And that's why it can be really important to understand your community and the resources that are available and where and what might be complementary to add to your school that just builds the community up, as opposed to like necessarily duplicating things that folks could get other places. So that comes from like a deep understanding of your community and the resources that are in them, and how can we build a system that is complementary and supportive to the work that is already happening without creating more burnout and more stress amongst the folks that are already doing the work, and focusing on quality interventions. And that may be the ones that have lots of research support as well, and also the ones that have support that have worked in your community. You are also able to collect data and study your work and see what interventions are working. Obviously, academic research provides one indication of a quality that we all sometimes in this field rely on, right? The research and support of others. But it is also not the only version of evidence that might let you know that something could work for your folks. And that's where the studying yourself can be really helpful. Being open to being wrong and choosing something else or making a pivot, or looking at your data and seeing how does this or does this not make sense for what we're doing, and can we pivot in a way that is better aligned with the needs, resources of our school and our community. So these are some things that can be really helpful to just come back to, right? When we're coming back to our why, these are kind of our some good ingredients for us to keep in mind when we're starting this workout or thinking about how can we even start to approach this. These are some good values to have: collaboration, understanding, high quality, and self-improvement in terms of doing this work. Okay, I think this is gonna work, but we'll see. I dropped a link to a copy of our school mental health quality assessment and an example of a report that comes out of our system. I'm going to talk a little bit about best practices in school mental health, which will go through a little bit more detail of those domains a few slides ago, where we saw teaming, needs assessment, resource mapping. The school mental health quality assessment was developed, oh goodness, about a decade ago. It has been updated to include more things around diversity, equity, and inclusion, and making sure that we are doing our part to create systems that are supportive and useful for all of our students. That was recently in 2019. But the original assessment was built out of a HRSA grant to really think about national performance standards for school mental health, because there weren't any at the time. So the team at the National Center at the time, I was not there, but developed this school mental health quality assessment that really brought together all of the best practices that we've seen from different teaming frameworks and what we know about high quality interventions, and focusing also on those support things that need to be in place to make those things happen. So we know that interventions are important, but so is training, so is resources in terms of being able to create a system that runs. Okay, so our first domain is our teaming domain. And this not only is thinking about the people, but also the processes. And one of the things that can be really helpful here is clear responsibilities when we're thinking about our folks. How can we um, utilize our existing teams? How can we make sure that we're not duplicating lots of different services, and that there is a clear responsibility amongst who is doing what? We also want to make sure they're multidisciplinary and diverse. We did a study a few years ago to look at uh, the links between team size and team diversity and the availability of services. And we did find that there was a small positive effect of having not only a large team, but a diverse team in the ability to be able to address the different tiers of services. So we know that it's not only important to have a lot of people that it can be helpful to have, numbers in terms of folks, but it's also important to have diversity in terms of role, so that we can create those complementary systems and continuums as well. Student and family involvement is really helpful. We recently created a family engagement measure for SHAPE. And to do that, we wanted to be able to get some input from caregivers. So we reached out to a partner of ours who was able to administer a survey for us through their network of caregivers. And it was really interesting to get the results back on, like, how should families be engaged in these different partnerships and in school mental health. And a lot of the responses we were got were more of like an advocacy nature of, I want to make sure my kiddo has access to these services, that folks are sharing information with me, which was really interesting, right? So not only thinking about how can we engage caregivers in our system to help us develop them, but also what kind of environment are we creating and what kind of environment are we inviting caregivers into. It can be helpful to understand too from a school perspective, right? Of, okay, we really want people to be engaged. But it's also important to think about what's already in place and how have we communicated that with our families, and that they know that we have high quality things in place to support our students. Community partnerships can be really helpful in filling in some of those gaps. So we know that a lot of tier one mental health promotion interventions are often delivered by counselors and teachers. So you may not need to engage a community organization in doing that work. But you may find that you don't really have someone on staff with a lot of trauma background and trauma treatment background, but you've got a community partner who does a lot of that work, and that may be a good way to create a relationship and complement some of the things that are already happening in a school building. And in addition to making sure we've got the right people at the table and in the room, it's also important to think about the processes that we use. We all know that sometimes you got one too many meeting and you wish that you had six less of them. So being thoughtful about people's time and how we're doing that work, how are we communicating, how are we tracking updates, how are we making sure this work is moving along, and that this work is being tracked and supported throughout those processes. Needs assessment and resource mapping is about understanding our students and our communities, and not just the needs that they have, but also their strengths. It is always helpful to think about what strengths can we leverage to address some of these needs, and how can we promote and encourage students to continue to build the things that they're great at without necessarily always focusing on the things where they are having a deficit or are struggling or need extra support around. There may be ways to build positive well-being by doing the things that they're really good at, right? And this can be really helpful to inform decisions about services and supports. So, um, depression and anxiety are really common mental health challenges that impact students and adults nationally and internationally, right? That's a true thing about the world, but it may not be a true thing about your school, right? With your fourth graders. So it's also important to pair that information that we know that is generally true with things that are specifically true about your community. Because maybe the more pressing thing for that is for your group of fourth graders is positive parent engagement and support around a behavior at home, as opposed to paying for an anxiety, like a coping cat intervention or something that folks can do. So, having a really good needs assessment and understanding of your students and your community can help you use your resources well to align with what is needed and what is a priority. Since oftentimes we don't have all the money to do all of the things all at once, knowing your community, knowing your kiddos can be really helpful in stretching and using your resources effectively until you're able to get all of the things on your wish list. Resource mapping is really helpful for understanding your community. So, what exists in terms of mental health promotion outside of these doors? What partnerships might we be able to develop to support kiddos after school? How can we connect caregivers to resources to support them in their mental health and their needs around housing, food, those really foundational things that we know can impact mental health and create barriers to getting to care, but are not necessarily in the requirement of a mental health intervention at that time, right? There's other things that need to happen before that. So this just again helps understand what we our community has, where might we have complementary things, and what our kiddos and youth are really good at and need extra supports around. Screening. And there are sometimes laws in different places. I'm not sure of the ones in Connecticut specific to screening, so I would definitely check up on that in terms of what the ins and outs are of like whether or not you need active parent permission, or if it's more of an opt out of a screening procedure. But screening in this context is about a universal screener. So this is the way that we're able to take a look at the landscape view of what is going on with our students and helping to identify those who might need additional supports without identifying any other risk factors. In this way, it allows us to make sure we're accounting for all the kiddos who may not um, get the teacher's attention or be at the top of the list for a referral, or maybe really quiet, or maybe withdrawn. So this is another way of making sure that we're able to have a pulse on generally where are our kiddos at and how can we use our screening information to again inform what interventions we might need or services we might need. And again, don't forget about strengths, and our social determinants of health can be really helpful here too on what might be useful in terms of being able to address and identify students and families who need additional supports. And this is a way you can also do these with your students and families and have them look over your protocols, or you can do a small little pilot and see if it's working out and giving you the information that you want. I think that is another take home message is none of this has to be done overnight, and there are ways to take small little chunks of it, one step at a time, and look at where we might be able to have additional improvements. Mental health promotion, or tier one, are those universal strategies to support and help positive mental health flourish. So, this includes things like having a positive school climate, thinking about our staff and how we are addressing staff well being and organizational well being. Are we creating an environment that is safe, supportive, that our teachers and our staff can flourish as well, and their ability to support themselves and their students is good for the whole community? Do we have a plan for behavior? Building healthy relationships. I think I saw that in there, of positive relationships. I like to point this one out because I know that oftentimes there can be funding constraints, or we don't know yet what intervention we want to implement. You can target and think about how we can build healthy relationships without any additional resources, right? Those can be worked out amongst the people in the room and in the building of how can we build healthier relationships together? What small part can we do there? And that can be a focus even when we're feeling stretched in terms of time, in terms of money. How can we say hello to every kid that walks through the door, or have a room, a way to have staff be supportive of one another? Another thing to think about when we're thinking about the interventions that we're doing, oops, is to also think about the support systems that we have in place for our interventions. So this would include things like using evidence-informed interventions, making sure they fit with the unique strengths of your local community. Do you have adequate resource capacity to implement these interventions, and the training available to do that, and a plan for monitoring fidelity? So some of these are the less fun parts, but they are important to think about, and they do help create a high quality system. So we have to think about not only what we're going to do, but how are we going to do it? And do we have the capacity to do it? And if we don't, what are some ways that we can streamline or start small and build towards it as we're building up some of our supports? They're similar again for early intervention and treatment services. So this is our tier two, which is often for students who have maybe early need or at risk, have a low level of symptoms, might benefit from a shorter intervention like a check in, check out, or a small group intervention. And treatment, which is our tier three, are those individualized interventions that are often targeted at one student or family to be able to provide long-term care or addressing clinical level symptoms. So these are our tier two and tier three interventions. And as you can see, some of the support things are the same. So regardless of what we're doing, we want to really think about what are the support things that we have in place to be able to administer and use these interventions well. And then we also want to think about how are we following through with treatment? Are we using SMART goals? Are we having a plan in place to address crises? Are we using evidence-informed interventions? And funding and sustainability are a way to make sure that our use of best practices in terms of using multiple and diverse funding streams to be able to support your school mental health setting. Are we using our funding and our resources to attract more funding and retain our staff and build partnerships and to fund all tiers? So to think not only about one of them, but how are we using our resources to have more options available for students? So some of this can be helpful in target helping staff to be able to think about next steps. And if you're looking at the school mental health quality assessment example, you'll see that it is rather long with a lot of information on it, and it is intentional. So the school mental health quality assessment is designed to be a quality improvement tool. It is our hope that if a organization were to pick one of those items, that the listed best practices can help them decide on their action plan. So that's why it's so long. It looks much nicer on on the internet. We have our shape system, uh that in there is the platform that we use, and it allows for an online administration of the school mental health quality assessment, and they get those nice little reports that you send. But on paper, I just wanted to let you know that that is one of the reasons why it is so long, is that all the best practices for each of these indicators that I'm talking about are listed right in the measure. So if you decided today that you really want to focus on improving your use of best practices with funding and sustainability, there are a slew of ways in which you might be able to do that, and some direction on what you might need to do to get to that next step. The last domain that we'll talk about is impact. And this is really about the documentation and the sharing and the studying of what we're doing. And this is the impact on educational and social emotional outcomes. Are we keeping track of how our interventions are doing in these areas? Do we have ways of deciding when something is not working and when something is working? Are we sharing this information, not only keeping it with ourselves, but with our students and our families or our district partners or our policymakers? Is there a way to leverage the work that we're doing and share out those things that would be helpful in attracting more funding or making decisions about what interventions our students need? So this can be a really helpful domain of getting into good practice of documenting and tracking and thinking about how can we improve and move these processes along. And I know that some of you all work in settings where you might partner with schools or be in a space where you are in a position to support schools as they're building out their system. So I just listed a few ways in which um, your work might complement others, and it might be that you're partnering with schools, right, and you could walk them through the school mental health quality assessment or participate on those teams. You have a wealth of knowledge around mental health, and some of you may be able to do trainings or classroom presentations around mental health literacy to their staff or to their students. Support professional development and training, or the development of crisis response protocols if schools or districts are in need, and think about referral pathways. I often think that the the help around data can be really helpful too. You all have a lot of knowledge through your studies in terms of being able to support folks around how can I manage a lot of this data and how can I use it in a way that makes sense for our team. So those are some ways in which we might be able to support schools as they are working through some of these processes to build out these systems. Okay, so in these last few minutes, I just want to share a little bit of the descriptive data that we have available on our online platform. So, the National Center for School Mental Health hosts the SHAPE system, the School Health Assessment and Performance Evaluation System. This it's a free web-based platform that houses all of our assessment tools, our resource libraries, so that it's a really great landing place for teams that are engaged in quality improvement or interested in improving their school mental health system. It includes our school mental health quality assessment. There's also our school mental health profile, which I like to think of as like a mini needs assessment. It lets you look at like what staff you have available in your system, what services are already there, how you're using data. So it functions a little bit like that. We also have assessments for more targeted areas. If you were interested in organizational well-being, there's a measure in there for that. If you are interested in improving your family partnerships, we have one for that as well. And we also have a preschool version of the school mental health quality assessment. So our goal, well, I don't know if our goal, my way of my way of thinking of the SHAPE system is like a six man, right? Like a person or a thing that has a really good understanding of quality improvement, what resources might be helpful, help set kind of the agenda of where we're going, and to provide some additional support to teams that are really on the ground doing this work, so they have an extra resource to put their data, look for templates, and to come back to when thinking about how can we move our system to using best practices more often. So the first set of data that I'll share is from our school mental health profile. And it, as I said, summarizes information on the services available in terms of like, yes, no, we have tier 2 services. Yes, no, we have a social worker on our school mental health team. Um, and we have anxiety supports at a tier 1, 2, or 3 level. So it's really simple data to just like, do we or do we not have these things in our system? So this is a little information about what we have in there. Oh, this is from about 1,300 schools. I will say that we have to be thoughtful about just the limitations of this data and the possible biases that exist. So, folks, this data is on our Shape platform. So, likely it comes from folks or schools who are engaging in or interested in quality improvement in some way. So, this may not be representative of folks who are not on the Shape system. So, this is a sample of schools that has put their information on our online system. But it does, I think, give a good place to start and to have conversations about what may be going on generally. So as you can see, the ones that are highlighted and in blue are schools endorsed having tier 1, tier 2, and tier 3 services available 80% of the time. So 80% of the schools in or over 80% of the schools in our system, said that yes, we have tier 1, tier 2, and tier 3 services. About 79% of them said yes, we are engaging in community partnerships. Screening, use of evidence-based practices, and engaging in kind of a self-study quality improvement things was endorsed much lower than those kind of forward facing activities like we talked about in terms of like school climate, having interventions at a tier 2 and tier 3 level. So it's quite common that most of the schools that are reporting here are saying, yes, we have an array of services available. Screening is a little, we do that a little, only half the schools endorse doing that. And only about 40% of schools said that we're engaging in an ongoing practice of kind of monitoring our system. The schools, almost 98% of schools endorse collecting attendance data, academic achievement data, office referral data, out of school suspension data as well, and to a lesser degree, school climate and safety data. The reason this information can be helpful is that we know that it's often challenging to figure out a whole new data system for monitoring and collecting your school mental health data. But there may be opportunities to leverage some of the data that everybody is already collecting: attendance, academic achievement, office referrals. Is there a way to leverage the information that we already have, that we're already collecting, to help us identify students who might need additional supports or match them to interventions that might be appropriate for them, or use it to monitor the success of our individual and our kind of system level improvements. So here on this chart, you can see about 50% of the time folks are using some of these data sources that they have to be able to identify students who might need additional supports. And then as we go over to the right, it becomes less, that they're using them to match to an intervention or to monitor individual level improvement or to monitor system level improvement. So I like to think of it as untapped info nuggets, right? This might be about 30% of the schools that reported said that they were collecting this information, but not using it as part of their school mental health quality, as part of their school mental health quality system. So this may be a way um, to help folks, like, oh, there might be something that you can already use, that you already have, that could help you make some of these decisions. So I like to think of this as our untapped little nugget of information. And the reason collecting data can be really helpful is it helps to identify which outcomes are really important, how we might be able to look at the success of our programming across different demographic groups, and develop strategies to improve our system and reduce disparities and inequities as well. The last bit that I'll share before I open it up for questions is just where some of our data is suggesting folks are at in terms of use of best practices. So if you see on the sample report, there's a mastery, progressing, and emerging level as like categorical summaries of use of best practices. On the school mental health quality assessment, you rate your use of best practices from a never to always scale. So there's 1 to 6 scale. From the data that we have so far, it looks like many teams are in this kind of progressing range. So that's probably our sometimes to often. We are using best practices in the domains of teaming, mental health promotion, early intervention and treatment services, and funding. Whereas we collectively, the use of best practices was a little less, maybe our rarely, never, sometimes for needs assessment and impact, which was our kind of data monitoring domain. So this just gives a general view of where folks are at. And I always, if you are going to use the SMHQA with a school or a district, it can be helpful to remind them that part of the school mental health quality assessment is aspirational, right? They're national performance standards. They're setting us up for where we're trying to go. Nobody is probably a 6, right? Nobody is probably using things, all best practices all the time, always. So lower scores are to be expected, and they give us room to grow and to think about how we can move towards that standard, that push to use them all the time. And then the last thing that I wanted to share is that there's a smaller group of schools that had at least two time points. There's quite a bit of variability within when that second time point happened. We recommend folks do a baseline assessment of their last year and then update the section that they're working on kind of quarterly. Um, but we did find that there with like I did a paired sample t-test, and there is significant growth in terms of change in total scores from one time point to the next. I put down here the three where there was a movement from maybe a categorical level of like rarely to sometimes, like with impact, right? We moved out of our twos and into our threes. And for early intervention and treatment services and teaming, there's a move from our threes, which are sometimes, to more of our often range. The effect sizes were between zero point 0.8 and 0.12, so quite large. They should be large enough to kind of feel in the place, even though the numbers are small. They do seem to represent a good shift towards more use of best practices as reported by our teams. Okay. And this final slide is just a summary of what I shared in those last couple of slides, that it seems to be that a high percentage of schools report a continuum of services being available, that they're engaging in relationships with community partners. Most schools are not screening students or engaged in quality improvement. They are collecting a lot of data that might be able to help them identify students within their system, but a good minority of folks are not using that data in their system, and that when they are engaged in this quality improvement initiative and go back and reassess themselves, they are seeing some change and improvement in their use of best practices. That is all that I have, and I am happy to take any questions that folks have, and I drop my email up here and I can put it in the chat as well if there are additional questions.
So we have about 8 minutes left, and folks are welcome to unmute themselves at this point, or I think they have capacity to unmute themselves or put questions in the chat. And I was going to say, do you want to drop the slides? If you have your email in the chat, then people can follow up with you after. But we'll go ahead and take questions, or I'll start with questions.
It's a whole room.
No, yeah. So I'll start with a question then. So your data were very interesting at the end. Basically, the questions about data use are a problem, right? Like, and I think it's great that we're collecting lots of great data now, but what we have found as well is that people don't know how to use it, or they aren't using it, or it's not getting to the right people necessarily at all the time. So what recommendations do you have to get those numbers up, if that makes sense?
Yeah, and I'm a proponent of the start small, right? So, and I think that can help with some of the anxiety around change. I think a lot of times our schools and districts can be, or any of us, right? Like making a total shift to something else can be really challenging, can bring up a lot of worries about what it means. So I do think thinking small and starting small. So maybe you look at your data for a grade level or a classroom and see how in integrating that into your use of identifying students or matching them to an intervention works. And then you can scale up from there to the whole grade or the fifth and sixth grade. So I think helping folks take smaller chunks out of it, knowing that you can start small and learn as you go,
Mhm.
can be really helpful, instead of thinking that the only way that you can use this data is if you use it everywhere, right? That there can be
Right.
a smaller learning process of how do we use this, and is it giving us the right information that we need? Um,
Well,
and
following up on that, then how do we even, the other challenge I see is how do we decide where's the right balance in data? What's the right amount of data? What data should we be collecting? Are we collecting too much data now? Like, did we swing it too far in the other direction?
Yeah, that's a good question. How much? Um, I would say that there is your numbers are only going to tell you so much, right? They'll give you reach, they'll give you kind of the standard numbers of scores. I do think it's helpful to have both an understanding of the quantitative pieces that you have, but to combine those with feedback from your students and your caregivers and your teachers about how things are going in practice and whether or not these things are working well. So I think pairing some of your data that you have already and talking that through or getting feedback from students and families can be a nice balance to make sure that those things are matching up and that we're being considerate of things that might not show up in data. Like I just have a really hard time. We're doing it at our first period class, and most of our kids don't come till a half hour late because they've got to take the city bus or something, right? Of like sometimes that things won't show up in your eval surveys, but if you talk to your students and you talk to your staff, you might be able to find a nice balance of addressing some barriers.
Sure. I don't want to hog the conversation anymore, so I'll open to other questions.
I'll jump in with a question. Can you hear us, Dr. Reaves?
Yeah, we
Yep.
got you.
Can you see us? We're in the room of people. I'm
So there's a whole room down there.
Yeah, we have a whole room. So this is a class of first year school psychology graduate students at UConn. And your points about systems thinking and strength-based assessment is music to our ears. Here's my question. As they are just starting and they're going to be in practicum and internship, for the next couple of years before they're out there, they're just becoming students of the system, right? So my question to you is, what is your advice to our new grad students as they're entering school systems?
I um I think sometimes it can be helpful, in my experience, to really pay attention and try to be a member of that community. I think in grad school, we learn a lot about what is generally true. And in some school, and in some instances, that is not always positive things that we learn, that certain kids are going to struggle, that certain groups are going to struggle, that certain things are going to happen. And I think sometimes walking in with all of that kind of thinking can be really challenging to be present, to look at what is going well, and focus on the positive things that you might be able to change, as opposed to sometimes getting bogged down by the giantness of it all. So really trying to be community members in your schools. Schools are run on relationships. Being in the good graces of a principal and a teacher and a helpful staff member can go a long way in being able to build those strong relationships to show that you're invested and that you care. And sometimes it can be helpful to have conversations about your length of stay there up front, so folks know that maybe you're only going to be here a year, but these are the things that you're hoping to do, because lots of folks bounce in and out of there. So I would say leading with partnership, leading with learning, and trying to be a present member of of the community, and thinking about what things are going well and where we can build upon can often be more helpful than coming in with just a lot of the outside noise that sometimes we get in terms of the statistics of it all, of what might be a challenge. I know that early in grad school that was a challenge for me. We go into a lot of schools that are underserved and kids are having challenges, and all the research tells you that they're going to continue to have challenges, and that can be really hard to be a member of a community and think of positive strategies when I was feeling kind of, bogged down by the bigness of it all. So taking more of a, I guess, a client-centered approach to the work can be a helpful way of being a good
Thank you.
partner.
Thank you. That's great advice. Thank you.
So I think we are at time for those that signed up as CSCH affiliates to meet with Dr. Reaves for a little bit longer. We're going to transition out of the WebEx and into the Zoom link that you should have received. So that'll take us a minute or two to switch over. But we thank you so much for your time today, making us think a lot about different things we've all are struggling with now or been experiencing or are part of a collective solution. So thank you.
Me.
Thanks, everybody.